How many of you have prescription drugs just sitting in your bathroom cabinet waiting for your children to take them to a party? What if I told you there is an antidote for prescription drug abuse and heroin overdoses? That this antidote has the opportunity to save thousands of lives each year. Would you make it available over the counter? Or would you let those addicts suffer from the life-altering decisions they have made? Naloxone, the antidote for a narcotic overdose, reverses the opioid-induced sedation, increases the respiration rate, and raises the blood pressure to the body's normal range. This antidote should be available over the counter because it has the potential to save thousands of lives with little pharmacological side effects. Opioids, also known as narcotics, are medications that relieve pain by reducing the pain signal sent to the brain. Some frequently prescribed opioid medications include codeine, fentanyl, morphine, oxycodone, and Vicodin. These drugs are available to be taken by mouth, injection, or in patch form to be absorbed through the skin. The current state of opioid abuse is a global problem that affects the health, social, and economic well-being of all countries. According to the CDC, 44 people die in the United States each day from prescription painkiller overdoses, almost 7,000 being treated in emergency rooms for the misuse of opioid drugs. In 2013, drug overdoses was the leading cause of death, causing more deaths than motor vehicle accidents. The widespread use of opioid drug practice is developing into a bigger problem. A cheaper and in some cases an easier drug to obtain has been making a recurring debut for the past few years. The number of heroin users in the United States has quadrupled in the last 10 years. In 2010, more than 3,000 fatal heroin overdoses, adding to the 23,000 prescription drug-related deaths. Not only does the growing opioid epidemic put individuals in harm's way, but also puts the U.S. economy in danger. According to the National Institute of Health, the United States spends almost $12 billion total on opioid disasters. That $12 billion is divided up into healthcare costs, loss of productivity, and the justice system. The leading cause of opioid epidemic is the overprescription of these addictive painkillers. Primary care physicians do not fully understand the facts about how people abuse these drugs. Doctors mistakenly said that they believe that prescription drug abuse is by snorting or by injection and cannot be abused in means of swallowing. But in actuality, pain medication that is ingested is equally as addictive as snorting and injection, and actually used more frequently because of the easy route into the body. The use of prescription opioids almost doubled between 2000 and 2010 because physicians underestimate the risks and overestimate the effectiveness of these drugs. However, physicians strongly support patients to get opioids from one prescriber in one pharmacy and support urine testing. These actions are not often taken because of the time it takes to implement them in real-world practice. One solution that would greatly decrease deaths associated with opioid overdoses would be expanding the antidote for overdoses. Naloxone has no potential for abuse, just the beneficial life-saving quality. The antidote is available only by prescription, but available in multiple forms such as a shot, IV, and nasal spray. Naloxone is a fast-acting opioid reversal drug that is safe during pregnancy, in young children, and in older adults. As of now, naloxone is only available with prescription, which could take weeks to get a doctor's office and days for the prescription to go through. But CVS has recently announced their expansion of naloxone to include more than 12 states to save more lives. Vice President Tom Davis stated in their announcement, over 44,000 people from accidental drug overdoses every year in the United States, and most of those deaths are from opioids, including controlled substance, pain medication, and illegal drugs, including heroin. Naloxone is a safe and effective antidote to opioid overdoses, and by providing access to this medication in our pharmacies without a prescription, In more states, we can help save lives. This announcement includes states including Wisconsin, Minnesota, Mississippi, and California. Ultimately, teaching and education is the best way to avoid the continuation of growing number of heroin abusers and prescription medications and illegal substances. But it is an impossible mission. Thousands of users are getting their friends hooked, and so on, and it will forever be a never-ending battle. Steps can be taken by physicians to properly teach their patients about abuse and the correct way to use these medications. The ever-evolving technology can be put to good use. Verifying these medications against the order properly, ensuring the patient is not seeking medications from different prescribers by monitoring the patient's medical chart and by simply checking their photo identification. Because of the dramatically increasing number of heroin users, a dramatic solution is needed. Increasing the availability of naloxone is a dramatic solution that will work. A program in North Carolina called Project Lazarus prescribes naloxone to patients with opioid prescriptions to avoid an overdose. If more states adopt this program, thousands of lives can be saved each year, each month, and even each day. If your loved one was suffering from an antidote from addiction, wouldn't you want naloxone available on hand in case of any emergencies to save their lives without hassle of getting a prescription? Are there any questions?
Yes. Are there any laws in place that could reduce opioid abuse?
Okay, very good question. I don't know if you heard her, but she asked if there's any laws in place for opioid abuse. And there is one, well, there are a few, but the one that I think is most important is the Good Samaritan Law. It is currently only observed by 17 states in the United States, and it provides a portion of immunity from criminal charges for those that use illegal substances and abuse prescription opioids to get naloxone without a prescription. Are there any more questions?
Yes, I had another.
Okay.
The Lazarus Project, I think you said that was in North Carolina.
Yes.
So when they hand out a prescription for an opioid, they just automatically get a prescription for the naloxone?
Yep. They get 2 prescriptions that day. They get the opioid and the antidote in case of an emergency. All right, thank you.